So to work with that frog in the throat is a very important thing, or to realize that frog in the throat from a herbalist, holistic practitioner's point of view, becomes fairly significant. Literally, this postnasal drip is to help the upper esophagus not burn. And this can be very dramatic, this heartburn. One of the most common causes, by the way, of GERD is candida. Because if you've got a mass in your lower intestine fermenting and trying to expand, it's trying to push upwards. And of course, that's going to push all the digestive tract material upwards. And so sometimes that frog in the back of the throat, that GERD, is a symptom of the candidiasis also. But what we really want to do is to see if it's impairment of some other issue or some bigger issue, but lots of times it's not. In fact, I have an awful lot of patients, as soon as they start feeling the symptom of GERD on a regular basis, they just do a detox, get everything moving in the right direction, and they're all right for 4 to 6 months. And a lot of people, that's all they really do, move things in the right direction again, clear out a little bit of candida, get in a good diet for 2 weeks or whatever. They tend to follow it to a degree. Then all of a sudden they realize they're eating a lot of potato chips and a lot of greasy foods and bad food combination. They got heartburn again, as they say, or they got that indigestion. Then they just redo the cycle. If you take, so here's the different aspect. Well, the medical treatment for it is they do lifestyle modification, drug treatment, and surgery are the 3 different ways that they work at it. The lifestyle, they're really trying to tell you to stop smoking, stop caffeine, stop chocolate, stop fatty foods, avoid wearing tight clothes, especially a tight belt, girdle, those kind of things. Yes?
Sorry, what surgery would they be doing?
Oh, they'll actually band the esophageal area for being able to do it. Sometimes set how the stomach is. It's basically ineffective. But they wouldn't start with that. They would go through several protocols, and we'll get there momentarily. But part of it's the position of the body, yes?
When they say stop chocolate, does that mean stop candy? Like no sugars?
Well, because of the caffeine in the chocolate, it'll affect them, so that's usually where people stop.
Okay.
But they don't usually say stop candy. From a holistic herbalist point of view, yes, we would like you to stop candy. But I'm just talking about the medical treatment. They'll say stop coffee and stop chocolate, but they won't say stop candy. But an awful lot of people think that is the only candy, so. One of the things, because this often comes up during the day, but it's much more dramatic at night. Because theoretically, you're supposed to be swallowing a little bit of saliva all day long, which will neutralize this and keep it moving on down the way. You don't produce as much saliva at night. If a person has bad GERD, they might wake up in the middle of the night almost vomiting, where the GERD has got really dramatic. And some people have choked to death. So it can be problematic. So one of the medical treatments is to have you sleep on a wedge, or literally sleep in a lazy boy. Something like that. So your esophagus is raised way above your stomach, and therefore it's a bigger upward slope. If you're laying down, it's not going to happen as easily. But that's typically not the case that's really caused it. One of the reasons a person's going to have it, and this would be very common of a pregnant woman, and it'd be very common if someone has a lot of belly fat, is when they're laying on their side. If a person lays on their side, and obviously even worse in their belly, they're putting pressure on their belly, and that's making everything go up. When a person lays on their side, their top leg usually flops over onto the bed just by comfortable position, and that would also put pressure on their belly, which would force this whole thing. So what is being suggested by the chiropractors is put a pillow between your knees. By putting a pillow between your knees, the top leg will not flop over, and then you won't flop on your belly. As much as this might sound like it's uncomfortable, virtually everyone who does it finds it's very comfortable. It's a comfortable sleeping position. This is originally utilized by the chiropractors to keep the lower back in good shape. But what it does also is keep the whole gastrointestinal stomach esophageal area in alignment, and so it really, really reduces GERD. Obviously, this is more important the larger the meal you eat, the later you eat it. So one of the biggest things to stop nocturnal GERD is not to eat late. To literally not eat after 7 o'clock if you go to bed at 10 o'clock. Leave about a 3-hour period. The people who get GERD the most worked hard all day, hungrier than a bear, get home at 10 o'clock. They wolf down a great big thing of pasta with a bunch of wine. And then they got this great big doughboy sitting in their digestive tract. And they're wondering why they get GERD in the middle of the night and they start throwing up. An awful lot of people get GERD when they've been out partying, they go to a convention, they eat a bunch of rich food, those kinds of things. Those would be a time that it would be even more important to possibly use this pillow between the knee, because it'll help that nocturnal GERD, that reflux action that can literally cause problems that a person could literally start vomiting in the middle of the night and sometimes breathe it in. One of the things that's also important is to avoid lifting heavy things right after a meal, especially if you have a tight belt on. Some people that have big bellies, even bending over too much right after a meal would do that. The medication that's usually used is ASA, which is toxic to the gastromucosa, or aspirins. Antibiotics, tetracycline to be able to kill the various things. The classical medications are Tums and Pepto-Bismol. And all they're really doing is lowering the acids in the stomach, so when they have GERD, they don't feel it as much. But as we already said, from our point of view, that's causing a deeper digestive deficiency, and it's slowing down the transit time even more. And then things finally go into past the pyloric sphincter, even more in a fermenting area, because the hydrochloric acid, etc., is not being involved. Sometimes they have hydrogen blockers, a deeper level of medication, so literally you don't produce hydrochloric acid. And if you don't produce hydrochloric acid, of course, you're not going to have the problem with GERD as much, because you won't feel it because there's no acids in it. But as you might remember, alkaline, acid, alkaline is a yin-yang situation. If you're not breaking down the first peptide bonds in the proteins, you've kind of compromised the digestion all the way along the line, and you're going to have more issues around that. But it is kind of interesting to look at, and I did have a link in your notes there of some video that you can actually look at to see how these things function. And they're really nice animations, and I highly suggest, if you have the time, to see how the proton pump is inhibited. But it'll tell you a little bit more how the parietal cells work in general, so we can use it for our own education too.